Hi guys, it's Miss Medic here, and today I'm going to talk about central retinal vein occlusion. So, the central retinal vein occlusion refers to a thrombus which effectively blocks blood drainage from the retina, and as you can imagine, there would be venous engorgement as there's nowhere for the blood to go. There will be increased pressure in the central retinal vein, and it will burst, leading to lots and lots of blood hemorrhages. And the signs of central retinal vein occlusion are in stark contrast to central retinal artery occlusion. And I have included this as it often comes up in multiple choice questions, and students and doctors alike get mixed up between central retinal vein occlusion and central retinal artery occlusion. So in central retinal artery occlusion, there's no blood hemorrhages, but there's a very pale retina, as blood isn't getting to the retina, and there's a pale retina with just one small cherry red spot. So if in an exam question they ask about a small cherry red spot, the answer is likely to be central retinal artery occlusion. There are a few other causes of cherry red spots, but this is by far the most common. And this will be discussed in more detail in another video. So, central retinal vein occlusion is a painless loss of vision, and in my ophthalmology class at university, the professor liked to talk about sudden painless loss of vision in three different categories: too much blood, too little blood, and the remaining causes. And whilst it didn't make much pathophysiological sense, it was a very useful way to remember the causes. So like vitreous hemorrhage, central retinal vein occlusion is one of the painless losses of vision associated with too much blood, because in central retinal vein occlusion we're getting lots and lots of blood hemorrhages. And it's also very important to differentiate between central retinal vein occlusion and branch retinal vein occlusion. So central retinal vein occlusion, we will see blood hemorrhages in all four quadrants of the eye, whereas in branch retinal vein occlusion they will be limited to one quadrant of the eye, of the back of the eye or retina on examination. And branch retinal vein occlusion is not caused by thrombus, it's more commonly caused by retinal arterial atherosclerosis, and this is when the retinal arteries become hardened over time, especially in patients with cardiovascular risk factors like hyperlipidemia. And in our retina, there are certain points where the retinal arteries will cross the retinal veins. And at these points, the retinal veins will become compressed by the hardened or atherosclerotic retinal arteries. And if you suspect the patient has central retinal vein occlusion or branch retinal vein occlusion, it's very important to refer to ophthalmology, and they will check for the complications of this condition, such as macular edema and neovascularization of the retina. And neovascularization occurs in the retina and or iris, and this occurs when there is ischemia of certain parts of the retina due to the blockage. The body in turn will create new vasculature for these parts, and this is hypoxia driven and mediated by the vascular endothelial growth factor, and this is why anti-VEGF treatments are used to treat patients with neovascularization. And also these new vessels can break off, and as they're very fragile, and this can lead to vitreous hemorrhage. New vessels can also grow on the iris, and if this is the case, this can cause a neovascular glaucoma. So the two main places the vessels can grow are the retina and the iris. If they grow in the retina, they can break, leading to vitreous hemorrhage, but if they grow in the iris, they can cause neovascular glaucoma. And these are normally treated with anti-VEGF therapy or laser therapy. The prognosis will depend whether the patient has central retinal vein occlusion or branch retinal vein occlusion. Surprisingly, branch retinal vein occlusion can sometimes be asymptomatic, so the patient has no symptoms at all, but central retinal vein occlusion will always be symptomatic. The patient will have a sudden loss of vision. So this concludes my video. If you liked the video, please don't forget to like and subscribe to my channel for more medical videos.